For 35 years, the NHS has been able to charge overseas patients for treatment. But in practice, few bills were ever sent out and even fewer paid. It's now 4 years since Jeremy Hunt first promised that he would get to the root of the problem.
Is it right that someone can come from overseas, perhaps a tourist coming from America or Japan, and actually pay nothing towards their healthcare?
But his success was modest. In 2013 to 14, the NHS reclaimed £97 million. By last year, that had gone up to £289 million. But of that, £164 million came from a new health surcharge for visa applicants rather than from billing patients. And it's still well below the £500 million target set by ministers for next year. But how much difference will upfront charges actually make? At Colchester Hospital, they say they might help, but only at the margins.
During the course of 2015-16, there was about £108,000 of billing associated with overseas patients, and of that we've got about 15% of that still outstanding. It's about £17,000.
It's a tiny fraction of the £270 million it costs to run this trust, but ministers argue recouping even small amounts of money will help. So how will the new system work? If you don't have an NHS number, it'll be assumed you're not entitled to free care for routine treatment. If you have an NHS number because you've had some treatment previously but are not resident in the UK, you will also pay up front, and your records will show you are a chargeable patient. It's not clear how much money the new system will raise. Labour suggests it's a distraction from the real funding crisis in the NHS. But it will mean in future there's a cultural change whereby patients from abroad are asked not just about their symptoms but also about paying for their own treatment. Libby Vina, News at 10 at the Department of Health.